David Cowlishaw, a consultant histopathologist for Western Sussex Hospitals NHS Trust, based at St Richard's Hospital in Chichester. I use TalkingPoint predominantly for microscopy and doing histology reports. The whole introduction of voice recognition has completely changed the way I work. We're no longer reliant on our secretaries typing our reports and the delays and the batching that involved. So there's the sort of the standard reporting. The thing that I find the most useful are the shortcuts, and most importantly, the shortcut smart entry reporting. So we now have all of our cancer data sets and a number of other reports, particularly for cervical screening and bowel cancer screening program specimens, that are all done by smart entry data sets. We're all using the same ones, so our reports have become standardized. We don't miss out any of the relevant information required in those reports because we get the reminders, or we get the options for those items coming up, and it's really good. You know, I'm bowel cancer screening lead for my trust, and when you get 22 bowel polyps removed, it's very easy to report. Each one I open up the polyp data set and it tells me the bits of information I need to put in, and it's extremely quick to report. The one thing I must say about the smart entry is that's brilliant is that it's all we can tweak the things that we want ourselves, okay, with guidance from TalkingPoint. It's not like we have to go to TalkingPoint and say, we'd really like it to do this. Can you tweak the main program so it does that? You know, if we're trying to do anything with a LIMS, you can forget it because the big companies aren't interested and they say, oh, wait for an update or whatever. Whereas I can go into TalkingPoint and create a smart entry report that suits my needs, that suits our department's needs, and you know, and actually implement that within department without having to go back to TalkingPoint and saying, oh, please, could you update this? So it's that user tweakability. Is that a good word? It's the user tweakability is really, really good. It's so much quicker. I mean, I wish I could quote some facts and figures at you and say I'm 20% more productive or whatever, but the fact is that I can dictate my reports. They're then ready to authorize there and then. Admittedly, I don't authorize and then. I do tend to batch authorize at stages through the day, but prior to that, you know, they would go into a typing pool, which could be anything from 6 hours to 3 or 4 days. Whereas now we've completely eliminated that. So anything that I can report is authorized that very day because the report's there when I do it. So we are getting a reduction in turnaround times. I can't quote figures on that, but we know that cases are being authorized very quickly once they reach a consultant's office. And you know, the mere sort of the journey that I would take with request forms back and forth from the office and so on and so forth is much reduced. Training is absolutely key, and whilst you know I'm quite tech savvy, I know kind of what I'm doing. I've used voice recognition before, and it sort of felt a bit backwards to go right from the very basics of the training, but in fact that gives you the grounding to then be comfortable with the software. So training is absolutely key, and I think also perhaps not to expect everything to work as smoothly and quickly as you would wish straight out of the box, but to ask TalkingPoint for help, because what we found is that we just assumed that nothing could be done about something. And in fact, when we went back to them and said, oh, we'd noticed that this happens, and they said, well, of course, yes, we can fix that, or let's have a look at it and let's fix it. So I think it's absolutely about training. Go through the training because it's very critical, and ask for help because it's an incredibly open company and to work with, and they're there to help sort out any issues.